Good morning, colleagues. Warm welcome.
Good morning.
Good morning.
Good morning.
Good morning.
Good morning, everyone.
Let's wait still a couple of minutes because colleagues are still joining, and I was also waiting in the meeting room, so I think that the meeting room is now open. So slowly, we will be starting. 1-2 minutes. Good morning once again to everyone. I think that we are still missing some colleagues that were in the waiting room. Just 1 minute. Yes, there are still colleagues joining. Okay, I think it's 10:04. It's a moment to start. Once again, very good morning to everyone, especially to our speakers, but also guests from Ukraine. I would like to introduce myself. I'm Ivona Ganko. I think that by now most of the colleagues already know me, and I will be just providing some technical information about this meeting, very important one that has been requested by the Ministry of Youth and Sports, for which I would like to thank very much, because for already more than 2 years that the ETF is focusing very strongly on the elements of policies on supporting young people in particular, but not only, persons with disabilities, for their employment and decent earning and a decent life. So I'm very happy that this subject was requested to be discussed in details. I would like to thank very much Deputy Minister Tokarieva for joining the meeting, and also welcome very much Mrs. Lomakina, who agreed also to share with us insights from current developments in Ukraine. I know we've been following already for quite a long time also the work of Mrs. Lomakina and the commission that she is leading, and therefore I'm also very happy that we can have a more specific discussion on the developments in Ukraine, but also on practices that we've been collecting across Europe and the world. And here I would like to welcome also Mrs. Hoffman, who is a very knowledgeable expert on support to people with disabilities and their transition to work, but also, in particular, Mrs. Hoffman has conducted long-standing research related to integration of young needs. And of course, we have with us my colleague Piotr Stronkowski, who will be leading the seminar and the discussion and will also present the research that has been done here in-house. From my end, I would also like to underline that the meeting is going to be recorded. This is also the request to share with colleagues who cannot join today. We have interpretation that is to be found under the bottom toolbar with three dots, and then there is a globe with interpretation. We will have throughout the meeting the interpretation from Ukrainian to English and from English to Ukrainian. With this, I would also like to just share that the meeting will take 2 hours, and we will be discussing, sharing different practices, and at the end of the meeting we will have a discussion that would be led by Piotr, but also here one of the objectives from my end would be to also identify elements that some specific that then we could investigate more in depth and have a more in-depth discussion according to the current needs and the policy developments. And with this, I would give the floor to my colleague Piotr for a welcome word and for sharing the entire objectives of the meeting. And I would also like to invite Deputy Minister Tokarieva to welcome all the participants. I'm doing it on my behalf, and I would like to greet all faces that I know and also those that I do not know yet. So I'm very happy that we can meet today, and also warm welcome to Mr. Andriy Chesnokov. I'm very happy that even from Vienna he's following the current work of the interagency working group, and with the recent meeting that we had, this working group is now entering into a new phase, and we will be continuing collaborating together, including through a knowledge sharing session. With this, I give the floor to Piotr for running the seminar and for moderating the discussion. Thank you very much. Warm welcome again.
Thank you very much, Ivona. And I would like to welcome everyone. My name is Piotr Stronkowski. I'm a human capital expert in ETF. Before I present the agenda, I would like to maybe invite Ms. Uliana Tokarieva to say a few words at the beginning as our co-host of the webinar.
Thank you, Piotr. Thank you, Ivona. We are thankful to all the ETF team for, I think, then 1 year support of the ministry team from the moment when Mr. Andriy at URC started this important initiative for Youth Guarantee. We all supported him, and now we have this wonderful result. I won't take too much of your time. I just want to say a couple of words. I want to thank ETF, and also want to thank everyone who is so deliberately in Ukrainian team moving towards implementing Youth Guarantee. We have a huge challenge. We have to prepare a national document which will be the roadmap in our work in implementing youth guarantee. I won't repeat the thesis that we discussed at the meeting of the working group. We are all evaluating results, but we are in the process of forming the model of economic independence of the youth, also youth with disabilities. It's a very wide framework. It includes the need youth, but the framework is quite wide. I'm thankful that Ms. Lamakina is with us today because she is the person who is moving the strategy of forward, which is oriented at youth, youth, people with disabilities. And now we have a challenge as a state institution is to submitting changes, suggestions to the law, which collects the statistical data. Until now, unfortunately, we don't have clear statistics on the youth with disabilities and their needs. So there are many, many challenges we all need to understand it. And today we need to remember about it when we will be collecting and absorbing the knowledge of our colleagues. We are thanking very much ETF for sharing your experience with us. Thank you.
Thank you very much, Ms. Takarieva, for these kind words. So we are trying hard to support Ukraine, and in this specific topic, we know how important it is supporting employment of persons with disability, especially young persons with disability. And we know that this is really very high. This issue is very high on the agenda in many countries, many EU countries as well, because in the EU we see that there is a lot of investment at the education phase, but in supporting persons with disabilities. But when we look at the employment outcomes, we see there is a lot. I would say kind of disappointment because the situation, employment situation of persons with disability is still not satisfactory, and the question is why, of course, and the question how to improve policies supporting persons with disability, especially young person who move from school to employment, is very critical now, and there are many research going on now currently. And during this seminar, we and Joanna Hoffman would like to share with you those findings we already have from those research. We very much focus on the rigorous research with randomized control trials. So when we have the comparison control group, and we can say that, okay, this intervention is working or not working. So we try to be very practical today and to go to the point and discuss what can work, what seems that doesn't work. And the agenda for today is very easy. So we I would like we will invite Ms. Tatiana Lomakina from the presidential office to present the situation in Georgia. In Ukraine, in terms of integration of persons with disability, young persons with disability. What are the current policy framework? What are the challenges? Then Ms. Joanna Hoffman, from director at the Ipsos Europe, will present one of the research. She was involved very much on the integration of needs into the labor market. The research was done for the UK government, but it analyzed number of policies and experiences in many EU countries, also in the context of persons with health issues and with disabilities. And we believe that those findings can be still very interesting for you and very practical. And then I try to share also some findings from international research, what we already know about effective strategies for inclusion of persons with disabilities, young persons with disabilities. Maybe I won't spend much more time on this. We will, if you will have any question, let's keep this meeting as a working meeting. If you have any question, just raise your hand, but you can click, the proper button. or we can also have the discussion after the presentation. But also, I think during the presentation, if you will have some questions, just do not hesitate to ask them. And so maybe I would like to invite now Mr. Tiana Lomakina from the Presidential Commission for Barrier-Free Environment to present what is the current situation in terms of supporting people with disabilities in Ukraine, what is the current policy framework, and what are the key challenges. Mr. Lomakina, the floor is yours.
Thank you, dear colleagues. I greet all of you. Thank you for inviting me to this very important discussion. It's for Ukraine. The shift of young people from education to employment is a very important step. And we noticed several challenges related to it. We see that European countries are creating policies, they are making different types of research, they are building the processes around this topic. But today I'd like to tell you how we are forming our policy, and if you allow me, I will share my presentation with you. Can you see my presentation? Dear colleagues, do you see my presentation? Yes, we can see it. Great. We do understand that the transition of young people from the policy, from the education to the employment is a very important thing for our economic recovery. It's also about our human capital, and it's about social cohesion. Today, Ukrainians, during the full-scale invasion, they feel not a lot of confidence because of everything happening around them. And such a type of support is an important marker that shows us that we are ready to be involved in the most important and complicated issues. Today, we have a national strategy for creating a barrier-free environment until 2030. And what is so special about it? We look at the barrier-free environment as something which should be interdepartmental. It should be in all fields like education, social services, transport, digital solutions, community development, of course. In our policy, the barrier-free strategy is based on 6 pillars. On one side, we have 3 spaces where people are living. I mean, for example, the barrier-free transport. You see it in the yellow color, barrier-free spaces and transport. Next, barrier-free digital space, where we need to remove all the barriers existing in order to make people use those services without any barriers. And then barrier-free information. That's also another pillar that we have. Here we look how to create such conditions that each person can use the information, even if this person has some hearing impairments, mental disabilities, any other types of disabilities, how to show the information to such people. And on top of that, we have 3 more other pillars. First of all, it's barrier-free employment and entrepreneurship. Next, inclusive education and lifelong learning, and social and civic inclusion. And when we analyze our state policy, and we don't look at it like through the prism of various disparities and disabilities, we first try to answer the question, what else can we do for our people with disabilities? And here is another checklist which we are using before making next decision. We need to analyze space in which the services will be provided, if this space has no barriers and accessible. We analyze also the services, whether the services are located properly, whether the people who are providing services are friendly and professional. Next, information. We check whether the information is easy to read and has a proper format. Products. We check whether the products are accessible and easy to get. And it's again about the spaces for young people, for children, for those people with disabilities, whether everything is accessible for them. This slide, you can see our target groups, key target groups, important for our strategy. And as you see, youth is a very important target group for us. If we talk about the context we are working and living now, here we identified important groups we are paying special attention to. First of all, these are young people with disabilities, young people with prolonged interruptions in education, for example, because they were staying on the occupied territories for a long time. Young people with learning losses or youth experiencing emotional and psychological exhaustion. These are also youth affected by war-related trauma, and of course young people who were internally displaced from their communities, from their hromadas, and then they can't stay any longer in their native territory. Here we also need to look at the emotional state of these people, conditions in which young people lived. In order to solve these issues, we need to develop such things as psychological support, life skills. We are also working with mentoring. Besides it, we need to create new programs of support during the first employment for young people. And we also need to think how to create such conditions for young people which have such disabilities that will demand constant support. If we speak about the effective system of the transition for young people from education or from school to work, then in the center of our attention we need to place inclusive approach, human-centered approach, cross-sectoral support. We should be focused on the potential of every young person in order to ensure that every young person can find their place in the Ukraine's recovery and economy. What else has already been done in Ukraine during the full-scale war? We are living through education reform, and an important attention is given to vocational education reform. Besides it, we are also modernizing the state employment services. It's an ongoing process, and we do hope that there will be a transit and the state employment service will be perceived differently. And after the reform, this place will become an institution that helps every person to find a job, to be employed. I can't say that they are not doing it now, but we still have some stigma, some wrong perception in the society, and we need to work on that. Another important issue is development of rehabilitation services. Especially it's important for young people who were injured during the war or who had some disabilities before. In such a way, we can empower our young people. Besides it, we also need to pay attention to the development of social services. Today, the Ministry of Youth and Sport is also actively developing the infrastructure for young people. This is an infrastructure which will be appropriate for young people with disabilities and which will give the best solutions for them. Besides it, we are trying to analyze the seamless transition pathway for young people from education to work, and we need to document all necessary steps and all necessary problems that young people are facing. We are currently making a research. We try to analyze how to remove the existing barriers which young people are currently facing. It's also important to talk today about those approaches that already showed themselves as successful in many European countries. We are interested in such issues as coordination between education, employment services, social services, and employers. On top of that, it's important for us to understand how to build individual support for young people. Another important aspect is to think how to support young people with disabilities today, and how to create such services that won't be just universal. It's not about just giving certain package of services to people with disabilities. These services should be adopted individually. If, for example, a person has difficulties to stand on his or her feet for longer than 10 minutes, we need to create such a working space for this person that will allow him or her to work according to its state. Next issue, reintegration into education and employment for young people affected by the war-related trauma. So here it's shortly about our strategy on a barrier-free environment. I'd like to thank you for this possibility to present and share Ukrainian experience to you, the way we move, the way we work, and those solutions that we are applying in order to find the best ways and the best approaches for our young people. Thank you so much for attention.
Thank you, Mrs. Lomakina, for this very interesting presentation. And I believe this presentation gives us a perfect introduction, perfect background for next following presentation. So now, without any hesitations, I would like to invite Joanna Hoffman to present your findings about inclusion of person of needs, not only person with disability, but more broader category of young people who are not in employment, not in educational training, and what are the effective strategies to integrate that person into the labor market. Please, Joanna, go ahead.
Thank you very much, Piotr, and thank you very much for the invitation to be here, and thank you very much for the introduction. Really pleased to be here. My name is Joanna Hoffman. I'm Director of Research and Evaluation at Ipsos, and I will be speaking to you today about the research that I have carried out and led in my previous organization. So this is not Ipsos work. I just wanted to make it very clear in the beginning, but nevertheless, I do know the research very well. So we have really looked at reducing need rates among young people. It was an international evidence and promising practices that we were looking for, and the results of that study I will summarize and provide some examples. Before we start, I just wanted to kind of reiterate what Mrs. Tatiana Lomakina mentioned. So why reducing need rate really matters, because the need problem sits really across at different policy areas. So it is about education, it is about employment, but it is also about health and social policy more broadly. So I wanted to pause just very briefly about why this is so important, because the research that I led really points out to the fact that the need status has long-term consequences for employment. This is particularly evident in terms of the employment opportunities for people who had episodes or experience of being need, but it also has implications for their future earnings. And even more importantly, it has implications for the next generations, because we know that young people from households where parents or carers were either workless or unemployed, they also have more challenges and facing additional barriers. So this is a problem that by addressing it now, we're really improving the chances of not the youth today only, but also future generations. So I just couldn't emphasize that more. And of course, from your perspective, young people with health conditions and disabilities face substantially higher risks of becoming NEET. This is something that we see in evidence across a number of countries, so this is not specifically unique, but I understand it's of specific focus to colleagues on the call. I do need to say that it wasn't necessarily a specific focus of the research that I have led. But what I wanted to emphasize is that because we were looking for effective interventions that reduce need rates, we were considering interventions that are targeting different groups of young people and operating in different contexts. So when you think about this from kind of a 3 aspects perspective, you have an intervention, you have a target population, and you have a context in which that operation is implemented. Then by tweaking one of those elements or kind of working with different elements, you will be able to potentially transpose and transfer the practices that work in certain contexts with certain populations to different populations in different contexts. So reducing need rates is both an economic and a social policy priority. And in my presentation, I'm drawing on the findings that we found based on the evidence review and the case studies. So the evidence review, it was the rapid evidence assessment, which is a systematic way of interrogating available literature, be it academic papers or grey literature, and that describe or kind of provide evidence about interventions that are designed to help young people who are either already neither in education, employment, or training, or they are at risk of becoming a NEET person. And in addition, to complement that search for interventions that work, we were also trying to understand what it takes to actually develop or kind of maintain the system that delivers support that allows to reduce the need rates on a kind of more systemic level. So not necessarily at the level of individual interventions, but thinking about the solutions and the context within the countries that make that problem less prominent or more prominent in some cases. The UK, that the study that I led was the beneficiary country, has very unique problems related to young people who are in need. And the study was specifically focused on the UK system. But that doesn't mean that the findings that I'm going to share are not necessarily not helpful for other countries such as Ukraine. And in selecting the interventions and solutions, I try to specifically focus on those that either provide support for young people with health conditions and disabilities, or that show results specifically positive or promising for this particular group of the target audience. So I will briefly speak about 3 examples of the 3 interventions. So the first is individual placement and support. The second is social and preventive medicine consultation. And the third one is a job corps. Now, I do want to stress that these are 3 out of many that we have identified. That doesn't mean that these have been the most successful or the most promising, but I think they will probably be the most interesting for colleagues on the call. So I'll start with the first one. It is individual placement and support is a type of supported employment that was, in this particular case, was adapted for people with early disabilities. So I will say a little bit about the original intervention in individual placement and support. This is intervention that has been implemented and tested across the world. It was designed for adult population with severe mental illnesses. And across the world, the evidence shows that it helps adults with severe mental health problems to get into work. So how does it work? It's a very new model because it really focuses on a person which is called an employment specialist. And that person is embedded in mental health settings, so in mental health hospitals or in GP practices. And that person works with a young, in this particular case, of a young person, and tries to place that person in work. So what is different about this intervention is a number of things. So first of all, it is starting with placing a person in a job rather than starting with improving their skills and qualifications by training. So it starts with placing, then training and supporting employment. Another difference is that the employment specialist is embedded in another organization that provides a specific support for that person already. So whether it's a mental health support, whether it's primary care support, whether it's a support for substance dependence or any kind of other condition, that employment specialist works with clinicians in order to provide a holistic support to that person that they're working with. So it's very individualized, it's very person-centered. And the third perhaps aspect that is very different from other interventions is that intention is that the support continues once the placement starts, once the job starts. So it doesn't leave a person out and about. It supports the person who is in the job as well as the employer, because the employer also often needs a support. And that's a particularly unique aspect of that intervention. So in this particular case, the intervention was slightly adapted to serve a slightly younger group of population, 18-29, who were not in employment or education and who were receiving welfare benefits. And the intervention was tested through a very robust method, which is a randomized control trial, which is a method that essentially allows us to say that the differences that we observe can be attributed to the intervention only, other than the factors that might have played a role. So we have a control group and an intervention group. So what this study found is that in the treatment group, the employment levels were much, much higher, 48%, compared to those in the treatment group, where they were only 8%. The intervention also improved non-vocational outcomes and improved the well-being of the participants. I will move on to the next intervention, but if there are any questions, I do invite colleagues to jump in. It might simply be easier to kind of take questions as I go along. The second intervention, it was implemented in France. The previous one was in Norway. In France, there is a specific infrastructure that supports young people who are neither in education, employment, or training. These are called missions locales, and I do apologize for my French accent, which is non-existent. Those structures basically offer a different range of services for young people. And this particular intervention tested whether integrating social and preventative medicine consultations as part of the broader offer in this infrastructure better supports people who are neither in employment, education, and training. So what that intervention really did, what the intervention was offered, was a consultation with a social worker. That the objective of that was to kind of eliminate, for example, financial barriers to access healthcare. It also took into account the situation regarding the health insurance status. So social workers were in charge of providing basic information about the healthcare system, insurance system, finding the most advantageous cover for them, assisting in registering with Social Security, and so on and so forth. And in addition to the consultation with the social workers, the participants were also encouraged to consult with a doctor who was on site. And the purpose of those consultations was to investigate whether the young person had any specific health conditions, what were their health habits and practices, to provide them with the health information, be it sexual health, health risk behaviors, lifestyles, or other. So that intervention was targeting people who were 18 to 25, that attended those specific structures dedicated to them. And again, it was tested in a very robust way using randomized control trials. So what that intervention proved was that the main objective of the intervention was to improve participation in training. That is an important aspect to mention, because the study found that there was a positive, significant difference in improved participation in training. So you will see 63% in the treatment group versus 56% in the control group. However, there was no effect on employment that was detected during the 12 months after which the research followed up the participants. Now, I'm not saying that that means that this intervention is not effective on employment, because the main purpose of the intervention was to improve participation in training, which it did achieve. But because of participation in training, sometimes it may be that employment outcomes simply take a little bit longer to materialize. So while this study didn't detect employment effects, that doesn't mean that there weren't at all. That's an important difference. The third intervention focuses on a very well-known model from the US. It's a Job Corps intervention. That study found substantial impacts on participants' employment outcomes, especially for youth with medical conditions. And that's what I wanted to emphasize. So the intervention wasn't targeting young people with medical conditions necessarily. It was a broader range of people that the intervention targeted. But as you, I'm sure, know, interventions sometimes work differently for different subgroups. So what works for one group doesn't necessarily work exactly the same way for people with different characteristics. And I think this is an interesting example because it was particularly effective for young people with medical conditions. So that intervention offered a very wide range of activities from a general academic education through vocational training and technical education that was aligned with industry standards. It provided hands-on learning opportunities, including employer-based training, for example, and placements in community service projects. It also focused on developing employability and soft skills, offered support in terms of housing and residential support for participants. There was a financial support through a living allowance for participants who enrolled to the program. But the essence was that it was very individualized, safe, paced service with staff that supported young people in transition stages. So this particular study looked at the effects of the intervention on the people who were 16 to 24, who were not in labor market or educational training system, so NEET. Again, it tested this through randomized control trial. And what the study found was that the intervention improved school completion and attainment. So how well young people kind of completed the education, what qualifications that they have achieved, but as well it improved long-term employment and earnings.
Joanna, I have one question because we have received one question from Uliana Tokarieva, Miss Uliana Tokarieva. What effectiveness tools were used to evaluate these approaches? What metrics were used? If you can say a few words about this, maybe before going to the next, because I think it's an important question, and I thank you very much, Ms. Lomakina, for this question. I think it's important to also explain a bit better, maybe the evaluation approach used for measuring the results of those interventions.
Thank you very much. Absolutely, a really great question, and thank you. Sorry, I missed it in the chat. I don't see it at the moment. So all those three interventions have been examined through randomized control trials. So I will use two to provide an example how it works and what exactly was measured. To the extent I remember, I might not remember the specific outcomes, but individual placement and support, it was evaluated through a randomized control trial. So there was a recruitment for this specific target group that was following the eligibility criteria. And if young people met the eligibility criteria, they would be randomized into a treatment and control group after the baseline data was collected. So the baseline data would collect information about the demographic characteristics, socioeconomic status, and kind of the current situation in simple terms. And the treatment group was offered the individual placement and support. So the participants in the treatment group worked on a one-to-one basis with this employment specialist, while the control group didn't. And 12 months later, and please don't quote me on the 12 months, but it's usually 12 months after randomization point, the researchers came and they checked the situation of those people who were both in the treatment and the control group. And they asked whether those individuals gained employment. So that you see the first marker here, the key finding. So the primary outcome of interest in this trial was the employment status. And it was, I actually happen to know it because I know a lot about IPS, and an individual measure of success for IPS is actually a very low bar, which is 1 day in employment during the 12-month period. After the follow-up. It is a low bar, but you have to remember that it is exactly the same for the treatment and the control group. So this eliminates any other factors that might come into play and allows us to say that if there is a significant difference, like in this case, that difference is solely because of the intervention, because participants were allocated to the treatment and control group randomly, which eliminates any structural difference that might otherwise come in between the two groups. I hope that explains the first study. I won't dedicate that much time for others, which I know a little bit less about. But for example, here, the randomization, it was a little bit different. So actually there was a 3-arm trial. So one group was offered only social consultations, only consultations with the social worker. The other treatment group was offered consultation with a social worker and the doctor. And there was one control group that wasn't offered any consultations, and they were offered the services that this particular structure, Mission Locales, provides for everyone. So everyone received something, but the first two group received a little bit extra on top of it, and that's the difference that the randomized control trial measured. So they looked specifically of what is the difference if we offer those two types of consultations versus what if we don't offer those and just kind of provide services as usual. And in terms of the outcomes of interest here, the primary outcome of interest was participation in training. So you'll see it's a different kind of focus of those studies. So the measures of success and the measures how the interventions are kind of considered successful depends on what their objective is. So one was focused more on employment, the other one was focused on training. Does this answer your question? Thank you. Okay. I'm mindful of time as I have a sense that I might be running slightly late. So very briefly, I wanted to bring those examples together, and not just those three examples, because these are the conclusions that we have drawn from analyzing a range of other examples as well. So what we find is that what seems to matter is that interventions that offer integrated support seem more effective. It's simply because you will know this better than I do that young people, especially with disabilities and health conditions, rarely face just one barrier. It's usually the multiple barriers that they face. So the integration of different types of support is bound to be more effective than if we're just trying to fix one problem. Early interventions seem to kind of be effective because they allow to prevent long-term disengagement. Very often I fall into the trap of considering young people who are neither in education, employment, or training as a homogeneous group. It's nothing like. There are people who are just kind of finishing schools as planned and they can't find jobs. There are people who are dropping out of schools. There are people who have bad experience in education. There are people who have been in and out of jobs for some time. It's a very diverse group. So it's important that we start preventing problems as soon as possible before they kind of accumulate and add up. Real work experience, so building confidence and the connection with employers is important. The one element that I didn't necessarily focus on in individual placement and support is the fact that employment specialists is actually expected to work with employers to find opportunities in employers to place young people in the jobs, and also work with employers to help them maintain those people and keep those people in jobs. Trusted relationships, this is probably one of the key aspects. So support, engagement and persistence allows young people to maintain motivation and confidence and ongoing support. That's one of the unique aspects of IPS. In this particular intervention that I provided as an example, the support was offered for 3 years. It doesn't necessarily have to be that long, but it is a particular characteristic of IPS that it tends to be a long-term support. It's expensive, but it works. So very briefly, moving on to how successful systems deliver this. So one thing to mention, we looked at the number of countries. We looked at France, Denmark, Netherlands, Australia, more closely. So what we found is that countries with lower need rates typically succeed through system design, not a single intervention. I think it's important because while some interventions do work, and we have evidence for that, they are not going to solve the problem because they are usually quite targeted. So what actually helps is to think about how to design the entire system in order to limit the problem at the root causes. And I think the key here is understanding the key transition points that a young person is going through different stages of education, and be particularly sensitive to those different transition points, because these are the moments when the young person is very likely to disengage, to drop out, face additional challenges, and just a little bit of support might actually help in that. So early identification. To make it a little bit specific, I wanted to provide some examples. So in the United Kingdom, we have a database, a system which is called National Client Case Law Information System. And that system is specifically designed to capture information about young people post 16 years old and identify and track young people who might be at risk of becoming NEET. Now, it's good in theory. In practice, doesn't necessarily work, but it's the good intention. That's a really good starting point. I'm definitely not saying that it works, because we have a lot of problems in the UK. But it's that data that allows you to understand, is something happening? Is there something that needs to be flagged to authorities about this specific young person to trigger the support more quickly? That's the key. Joint up services. An example here comes from the IPS that I provided, which is the best example to illustrate the joined up services, how it works, because it's embedding a specific service within another service. And the employment specialist function that I say, they have a function to bridge different services, to kind of work with the healthcare services, with the medical services, with education system, in case if this is supported specifically for young people, but also housing, welfare, other systems, in order to help a person navigate that system more effectively. And systems are not necessarily immediately joined up. So having someone or a forum or a platform to coordinate that's really key. Clear accountability, an example from the Netherlands. So municipalities really have the responsibility for helping those young people who drop out from the education system to either return to school or to find a job. So it's clearly, accountable for who is responsible for that. So it's easier to hold them accountable. Local coordination. Again, in the Netherlands, there is a regional registration and coordination system that allows for the flow of information to for coordinating of actions between the schools, between the public administration, employment services, and local municipalities to coordinate support is necessary. Employer involvement. I think creating labor market opportunities is really key. Again, the different ways of doing it. The IPS has a specific way of doing it because it's just simply reaching out to employers and keeping them engaged. But sometimes it's including the chambers of commerce. It's including the representation of businesses in consultations. Very often, large employers have the capacity to support young people who are placed in work because they have HR system. Now, if you think about small businesses, they barely have a person who's responsible for HR. So how do small businesses that provide the bulk of employment in any country can support young people, especially with disabilities and mental health conditions? They probably don't know how. So is there a service that would allow them to kind of tap on and learn from best practice, or simply help them out to make that placement of young person effective in the small firm? And long-term engagement, I think that one I've emphasized before. So support continues throughout key transition and job placements. So the example that I have here is just from one country for the sake of time. In 2025, the Netherlands had the lowest NEET rates in the European Union, and it has had the longest. It has maintained a champion role throughout many years in the EU. So it's a really the example. If anyone is looking at good practice examples and countries that are successful in this area, it's the Netherlands. So that's why I picked that one. it doesn't necessarily mean that the solutions in the Netherlands are easily replicated in other countries, because it's very different to Ukraine, it's very different to the UK as well. But there are some aspects that are perhaps a good lessons or inspiration for others. So very briefly, first, instead of focusing on keeping the requirement to keep young people in education, the Dutch system focuses on the requirement of gaining qualifications. It's not about staying in education, it's about gaining qualifications. Difference. The second one is career learning through education. So career advice. In the UK, it's fair to say it's a bit patchy. In the Netherlands, it really continues throughout different stages of education, from secondary ongoing, and it also provides different pathways to change the education pathways and change then the kind of career trajectories going forward as well. That's really important. Third, continued support after compulsory schooling. So then again, there are specific solutions to help people after they've finished school and gain qualifications to transition them to employment. So that's the transition point number one I mentioned. Okay, there is a different solution that is focusing on supporting employment for those who leave school early. That's, again, it's a different group. It requires different support. It requires different solution. Again, a transition point, important to note. And finally, the one I already mentioned, tailored municipal support for unemployed young people without benefits. So there is a particularly difficult group if they're not benefiting, if they're not supported through the social security system. So kind of focusing on those who are in particular need is an important element. And I only have just very few practical lessons, which are quite generic, therefore no need to kind of spend a lot of time. But hopefully through what I said, it hopefully is kind of clear that, and I'm sure that you know it already, that investing in prevention is better than cure. And investing in education is really important because it changes employment chances going forward to start with. So I couldn't emphasize it more. Coordinating education, health and employment services, key, especially for people with disabilities and health conditions. Provide more intensive support for those who face multiple barriers. Again, not necessarily a rocket science, you probably knew it already. Build stronger employer partnerships. I think that is the one that is very difficult. Everyone struggles with that, but it's worth investing and exploring. And a final takeaway, there is no single intervention that would solve magically the problem because of the diversity of the group. So it is, I would encourage everyone, and I have encouraged the UK government as well, to think about changing the system rather than identifying a specific intervention that works. Intervention will help. And a range of interventions as part of the youth guarantee that you were planning on considering is a definitely great starting point. But use this as the opportunity to think about integrating the system and kind of plugging those gaps through which the young people fall into this need status. And I think I'll stop here and I'll see if there are any questions.
Thank you very much, Joanna. Thank you for this very interesting presentation. And now maybe I will ask our colleagues, are there now any questions or comments? Oh, I see one heart. Thank you very much for
If
this.
I may, Piotr, I have difficulty to put my hand up.
Okay.
Sorry, but I would like to thank very, very much both of our speakers, actually, also to Tatiana for highlighting the current developments in Ukraine, and to Joanna for really shedding light on what can potentially work. But I wanted to emphasize one thing. Actually, while Joanna was explaining how actually the design for successful measures should look like, I noted all the elements that actually we were investigating are part of the philosophy of the youth guarantee. So here I wanted to underline that exactly we are discussing setting up a youth guarantee framework in Ukraine because it really provides an opportunity for the system change, and it starts with the system design. It's not a project, it's not a program, it's not a single intervention, but exactly the design of the system changes in multiple policy lines, and starting from education but integrating also career guidance, work-based learning elements, and then towards successful employment. Yes, the target group is probably more difficult because, well, as rightly said, the challenges are not just one of them. It's a set of challenges, but we are discussing today a particular group of young people with disabilities, but actually NEET group, as also underlined before, is so diverse that is facing different challenges, but nowadays also young people are actually that we would not see them as potentially vulnerable, are also facing different challenges in a school setting, also there are many developments that we are also investigating the impact of social media. I wouldn't mention even the huge impact of current war, the Russian aggression in Ukraine that has impact right now and will have serious consequences in the future as well. So here just wanted to underline that exactly we are focusing very much on the design of the initiative such as Youth Guarantee, but could be also, and this is what we are discussing in Ukraine, expanded beyond the recommendation from the at the European Union level that focuses on young people of the age 15 to 29, while in Ukraine we were discussing of expanding the age brackets till 35 as the legal definition of young people in Ukraine. But actually all the elements that are already in the design of this initiative and the system change can actually be implemented for also adult population. So this is exactly those elements that have been highlighted as success factors, and this is why I wanted to underline why it is so important to discuss those elements and how actually through the prism of implementation of the youth guarantee also adult population and the system change can benefit from the work that is being currently done in Ukraine. So thank you very, very much for both presentations. And I can see Julia with who was much more successful than myself with raising the hand.
Yeah, maybe I will continue with the question because I was wondering, thank you for the presentation, and especially such country like Norway and Netherlands. So they have a good, like low level of NEET rates, but maybe you can I don't know, give us advice about the country which has the biggest delta, which was the low, like the high level and become a low level, because we need to have that, let's say that, jump to make this jump in Ukraine, because we have not such, let's say, so far not such a low level of nitrates, even without the statistic information. We can see it with our hypothesis already. So maybe you can give some advice. We would be really grateful. Thank you.
Thank you very much. That is such a great question, because that's what our client asked us as well. So they were interested, and that it's natural that it's interesting to look at those differences. I won't be able to give you a lot of information now, but I can first of all point you to the report when there is more information and might be easiest. But I mean, there are a couple of things to mention. So we looked at, there are academic papers that actually look at the countries that kind of reduce the gap, and they're looking for, what was that, or how those countries differ from others that might have allowed the reduction. The problem with the massive reduction is that you never know what kind of caused that reduction. So you don't know whether there was a change of policies, or whether it was a change in economic conditions, for example, or it was a combination of both. So yes, there are countries, like, I think from memory, I think Belgium, Italy, and some others that I think actually one of the Baltic countries had quite a kind of effective reduction of the nitrates. However, it is much more difficult to attribute what that reduction was caused by, and there are different theories and different papers explain it in different way. I'll try to find out more information, and I will point you to the report where I hope it will be available. If not, I will try to dig it out and pass by my colleagues. But in short, I just wanted to caution that it may be very different factors, that a combination of those kind of allowed for the reduction of the problem, if that makes sense. Or a simple change in the definitions or like statistics. I'm sorry, but sometimes that is unfortunately how things work. But not the case in the European countries, because that's kind of harmonized, thankfully.
Thank you very much, Joanna. It's true that it's not easy, but relatively easier to make the randomized control trial for individual, for very specific intervention, whereas for the whole policy, it's much more. Basically it's impossible. Of course, there are many research comparing different countries, but with different settings. But there are so many factors in place that it's much more difficult, if not impossible. But I think we can learn and from other countries, and this is why we are meeting here. And of course, we are not supporting the simple policy borrowing, because we know this is a kind of the shortcut which not always play well. Sorry, but I would like to say that but the inspiration and learning and thinking what are the factors behind those successes can be really important. Okay, so maybe if I don't see any more questions, so maybe I will jump to my presentation and then we can continue our discussion. I try to be quick because we have not much time left. So I try to share my presentation, and one moment, because oh yes, here it is. Okay, so I try to also I think that just to explain that I think there will be some similarities and some repetition between Joanna's presentation and my presentation. And it's maybe not bad, but I wanted to tell it, to say it from the beginning, that please don't be surprised. But I think maybe it's not bad that the conclusions are quite similar. And we work on our presentations independently, but observations are leading to the same direction. So I think you can find it interesting. So I tried to look at some international research. I prioritize systemic reviews of different interventions. So systemic reviews are those which try to look at the bigger number of research done by different stakeholders, different research institutions, and then try to summarize those findings and try to make some more general conclusions. So let's say that systemic reviews are stronger usually than the individual evaluation, the individual research. And at the end of my presentation, we'll share with you the presentation, but at the end of my presentation, I provided all the references I use in the presentation, so you can look at those papers and read them, because I think very often the devil is in details, and of course we can't go much into details, but what really matters to understand properly what we are talking about. So we will talk about the topic how to support employment of young people with disabilities. And I start with the main message, I would say. It's very similar to the message which was formulated by Joanna. But when we look at the different measures, different research, different policies, we see that what works the most seems to be most successful. When the support is delivered in the real workplace, that we prioritize workplace engagement in the workplace, and then that the support is also individualized. It begins early, so early intervention is important. It involves employers, and it's continue after recruitment. And very often now it is a kind of this model is compared to what is called traditional model. Traditional model, it's mostly rely on the kind of the next steps action based on the steps. When first steps, we try to prepare the person with disabilities to employment. We invest in the skills of that person, with the motivation of that person, attitudes, rehabilitation, and so on, and very long process of preparation. Then we hope that we will place that person in the employment. And the new model tried to reverse this traditional way of thinking and say, no, play first, job first, place that person in the workplace, and then train the support. But why that person is the workplace, not first train or first invest and then try to place that person in the workplace. So this is, I'd say, the central message. I put it a bit stronger, maybe than the proper researcher should do it, but okay, I used my privilege that I'm a consultant, not a researcher. And yeah, so, but this is, and I try to explain why it is like this. So first is that supported employment seems to work better than traditional vocational preparation. And what is supported employment is that supported employment is the broader category of intervention in which we try very quickly, rapidly find employment and place the person with disability into employment, and then support that person in the workplace, and to help that person to adjust to the workplace requirements and retain the job. And exactly this is the example of this, let's call it a new paradigm that's first to place, then train, instead of the more traditional, which I described before, train then place service. But this type of approach, I should also say that it is research for people with mental health conditions. While evidence for other disability groups is still positive, but less extensive. I think this is because also many research are done for the person with mental health issues, because maybe this group is considered as one of the most difficult in terms of integration on the labor market. So, but this should be also considered. Maybe this is the topic for for the next research. When we talk about supported employment, you can ask, okay, what does it mean in practice? And that means that several steps and several elements. I will briefly go through it. Just first, when the employment specialist start working with young person with disability first, that the employment specialist try to identify what are the strengths, what are the preferences of the person with disability, what is the history of that person, experience, and so on, and then try to quickly find the proper job for that person. Of course, having in mind all the requirements, all the characteristics of that person, and try to through individual contact very often with employers, try to find the jobs which match the preferences of that person, so which seems to be appropriate for that person. So this is what we can call individual matching. Very often the employment specialist is not only reviewing the advertised vacancies, but also contacting directly employers and talking about the possible job places, possible adjustment at the job places. And also the employment specialist helps the person with disability to prepare to the recruitment and the disclosure of the information about disability. We know this is a very sensitive topic and sensitive moment. But also at the same time, employment specialist can work with employer and help employer to adjust the workplace, because we see that employers, especially middle level managers who are not on the top, but they deal with daily operations, they are afraid. And they have different fears, and this is normal, this is understandable. How the person with disability can function in the workplace, what type of adjustment I need to make, how other colleagues, co-worker will behave, what will happen when the person will have some health issue, and so on. So a number of questions arise in my head if I will be a manager, and I will say, maybe this is additional problem for me. No, maybe I will not employ that person because it is only additional work for me, workload, and so on. So it is important to provide for that person, for this workplace advice. What can be changed, how we can accommodate a person with disability, and showing it also that doesn't change very much organization of work, or it's not related to high costs. Then the employer, after the recruitment, the job coach, this employer specialist, we often call it job coach, start working with that person with disability at the workplace. So that person, the job coach, for example, can train person with disability different tasks which has to be done, specific tasks which has to be done in the workplace, step by step. Maybe teach the person how to behave in the workplace, what are the norms at the workplace, how to communicate with coworkers, with managers, and so on. But also support the coworker, supervisor, and coworkers how to behave, how to communicate with person with disability. And this support is also continued after the recruitment. We make sure that the situation of that person is fine, that situation of the team at the workplace is fine. And also what is important, it includes also some coordination with health, education, and social services. Because very often supported employment also include element of supported education. If, for example, that person want to continue education or want to have some issue with benefits, disability benefits, it's also important to solve those issues, or have some health issues. So it's important to coordinate it. So this was also the question from Ms. Lomakina about this coordination issue. And I would like to underline that we see that coordination issue in those type of intervention is very important. But there is usually one person, we call it employment specialist, job coach, whatever. But that person takes on himself or herself the task of coordinating different institutions, because there are many rules, many procedures, and really sometimes it's difficult. But we know that it's not always easy because it's issue of time and other constraints. But I think this is also important. Another finding is about individual placement support, and this is the intervention mentioned by Joanna before, and we see that this is the specific type of supported employment. So this is to make sure that this is maybe more regulated, more rigorous approach to supported employment, but this is type of supported employment specifically for person with mental issues, mental health problems. And here I wanted to refer to one systemic review of 7 randomized control trials with almost 700 young adults with mental health conditions. And we see that the results may be in total for this are not maybe as impressive as those cited by Joanna, but still are quite important. So almost 60% of participants receiving IPS obtain competitive employment. So this is employment in the open labor market. We are not talking about sheltered employment or subsidized employment, but the real labor, real work. And compared to 32 in control services. And we see that the probability of finding employment under IPS was much higher than when the person used the more traditional services. And also the job duration was much longer than in case of the traditional services, which is also important because we are not talking only about entering the labor market, but also in retaining at the labor market. So it is important. And this IPS, just to mention, it was mostly mentioned also by Joanna, but of course, just to repeat it quickly, so objective is the competitive employment in the labor market. And the main criteria for entering is the willingness of person to work. We do not set any entry criteria that we have to test whether the person is really want to work or have the ability to work. No. If somebody wants to work, is automatically eligible. But also what is really important is what was mentioned by Joanna is that employment support is integrated with mental health. So it can be the situation that actually employment specialists work in the mental health institutions. And it's very rapid. It's very rapid, and we don't spend time on preparation and so on, but we start very quickly searching for the job. And this is the main first step. But of course, not first available job is selected, but the job which is appropriate for the person. We build relationship with employers and continue support as long as it's necessary. But also we provide that different advice about, for example, benefits, social benefits, because we know that benefits, disability benefits can be sometimes, I wouldn't say the motivating, but but some person with disability can see that maybe it can be a bit risky to enter the regular employment, competitive employment, if they can be afraid of losing the benefits. So of course we have to manage it carefully to avoid those types of the threats and fears, and but also it is important how the benefit system and actually encourage young person with disability to enter the labor market. So this is the kind of I think the linkages between the benefit system and employment measures. And another example, another intervention is also the logic is quite similar, but however, it's targeted at a specific group of young people with disabilities. So those who are still at the education, at the secondary education, it's based on the project Search, and the project aim to support prepare those persons to enter the labor market during the final school year. And the support was very much focused on the very intensive internship. So those young people were very much embedded in the large employer and rotate through several on average, I think 3, if I remember correctly, internships in different positions. So they could really learn about workplace, about the enterprise, while the classroom instruction was limited. And here we can again, based on some randomized trial, we see that the effectiveness of this program was much higher than before. Okay, I see that you understand some messages in chat. So it's 73 compared to 70%, so 17%. So you see that the difference in effectiveness is really important. But what is saying is that the last year was very much focused on internship, work-based learning. So again, it is more about placing the person in the workplace, working environment, then investing long time in preparing the person, career guidance, counseling, and so on, so on. Of course, it was also present there. I don't want to say that it was not present. It was present, but the main objective was to put as quickly as possible that person into the real employment conditions. And what is also interesting findings is that paid work experience before leaving education is also a strong predictor of later employment. So those young people who had at least one paid work experience, so it can be paid internship, paid internship, those persons had much higher probability of finding paid employment after leaving the school. This is important because this is the characteristic of the paid internship, not unpaid internship, and that paid is for young people. And someone can ask why paid internship changed the situation, and of course there are many theories behind it. But what is convincing to me is that if the employer has to pay to the person who has an internship, the attitude of the employers is changing, and then employers start treating the person as actual workforce and trying to investing more in the training, but also putting that person in the more serious job tasks and treating that person more like a part of the workforce of that employer. And that's why maybe this period is more intense in terms of the work experience. But okay, this is on my speculations. This is not about the findings. But that also I should say that those findings are rather based on observation than experiments. So the evidence is a bit weaker, but I think it's also worth to remember. And the next presentation, the next conclusion is what I mentioned before, that workplace support is as much important as a preparation of one person with disability. And this is very often neglected element in many countries, ETF partner countries, that we think that employers are not willing to employ a person with disability because they lack financial incentives. So we invest a lot in the building financial incentives like quota system, job subsidies, and so on. And we see that it is not sufficient. We need employer-oriented intervention, which try to help employer to adapt to employment of person with disability. It can it may include accessible recruitment, when we help the employer to redesign the recruitment process to make it really accessible. Maybe it would require a bit of the redesign for the specific person, introducing a flexible working time, introducing assistive technology, introduction of clear written or visual instruction, making managers and colleagues, co-workers more aware about disabilities, additional boarding time for person with disability, and so on, so on. So these are a number of very practical solutions, very practical steps, which helps adjust the workplace to the needs of the person with disability. And this seems to be quite important. And also I would say that what we can see also that when we compare integrated or segregated vocational models, so we find that integrated service produce better outcomes. Segregated vocational services are those who are specifically designed for persons with disability. For example, one example is sheltered employment. When persons with disability are working in the very specific enterprise or workshop, or however we call it in different countries, there are different names, but they are mostly only persons with disability, and they work in the very sheltered conditions designed specifically for the person with disability. And usually, persons with disability feel fine at that workplaces, but the idea usually is behind those sheltered employment that this is only transitional employment, and the person with disability can at some stage leave that employment, sheltered employment, and go to open labor market. But it doesn't work like this. Usually that person stays at the sheltered employment. I can tell you that I can see it a lot in Poland when we have a lot of this type of sheltered employment, different forms, and there is a big issue of the very low rotation. If somebody enter the type of the employment, usually stays there as long as possible, and all the system is organized in that way, and the staff at those institutions try to maintain those people in those employment. So this is really, I think, important not to fall in this trap of creating sheltered employment environment, but rather prioritize open labor market and think how we can introduce person with disability to the open labor market. So when we try to summarize what works, early intervention, it was mentioned also by Joanna. Usually it's ideally when we think about the transition from education to employment is that it should start before the person leaves education. Paid work experience should be prioritized because if the person with disability should receive real wages, very individual job matching. So I don't say that, I would say rather that we have to carefully analyze what are the strengths, what are the potential of the person with disability, and what types of job that person can perform. Of course, we can sometimes stretch it a bit, so try to push that person to take a bit more ambitious work, but it is important to make this matching proper. Very intense cooperation with employer and support for employers, and in the workplace accommodation, also introducing different solutions which help accommodate the person with disability better. And we continue the support. We do not stop the support once when the person with disability enter the employment, because it is the most common trap, and but if we want to retain the employment, we have to continue it. Maybe the scale of involvement can be decreasing, but still we should monitor the situation. And what doesn't work, or we can avoid prolonged assessment before job search, when we try to really very deeply analyze situation and so on. Then investing a lot in classroom training, disconnected from vacancies, unpaid placement, sheltered employment, and also withdrawing support immediately after recruitment, awareness campaigns for employers without recruitment assistance and different workplace adjustment assistance, quotas and subsidies without job matching and support. This is what I mentioned before. That's quotas and subsidies alone does not work, or have very mixed results. And also, it was the question what metrics were used we should really focus very much on measuring employment and retention, different aspect. And of course, we can discuss how to measure employment, how to measure retention, but we shouldn't measure participation in different activities. It's important. And I was thinking about some kind of the pilot. Is it possible to have a pilot? And then if we thought about pilots, so we think that it can be designed something for like this in Ukraine for young people who have some disability or long-term health conditions, want to enter employment, but need some more intensive support. And this can be kind of the package. Let's propose a package for those persons, like including vocational profiling and paid workplace placement, employment specialist. It is really important. The job coach, whatever I call that employment specialist, it's really important that we have this person with small caseload. Not many people. That caseload should be really low. I don't know, like 20 people, no more, per one employment specialist. Employer in very intense cooperation with employers, workplace accommodation fund, because sometimes we need some money for accommodation, usually not very big amounts, but adjusted to the specific situation. Advice on benefits and some follow-up. And also, when needed, some integrated rehabilitation and health conditions. So, and these are those possible variants, because that pilot may include different various pathways for different groups of people. And yeah, so this is one. It can be individual placement support. Then another can test supported internship pathway. And maybe more customized employment pathway, and maybe some also element of apprenticeship. These are references. So thank you very much for your attention. And if you have any question, I'll be happy to answer. Or you have any comments. Yes, Joanna. Yes, please go.
Piotr, just to say that exactly the pilot that you mentioned, that's exactly what I'm doing at the moment. So in the UK, we will be testing whether a specific adaptation of IPS for young people will work if we embed employment specialists in mental health settings for young people. So it's very different, because if you think about young people, the focus is not always only on employment. And we're looking at the group that is 16, 17 years old. This group actually could benefit from engaging or re-engaging with education as a route to employment. So there is a modification of IPS for young people, and we will be testing it through a randomized control trial. So first we examined whether it will be feasible to implement an RCT in Greater Manchester settings, in children and adolescents mental health settings in Greater Manchester, and we concluded it is, and we will start with a small an RCT pilot before moving to a full-scale trial if the pilot is effective. So that's exactly the kind of process we're taking.
Thank you very much, Joanna, for this comment. I think this is also, I should mention that we would highly recommend to Ukrainian government, if you would be interested in designing any pilot, to do the randomized control trial before, because we assume that in the Ukrainian context things may work differently. What does it mean is that we need a proper design of these randomized control trials before, so just to make sure that we have, after recruitment, we have some elements of randomized selection to different treatment on the control groups, person with disabilities. Of course, it prolonged the period of preparation, but we believe it can really provide much more insights into the nature of the intervention and the effects of the intervention, and understanding what works, what doesn't work. And I remember quite recently I had a discussion with one of the Ukrainian colleagues about different piloted experiments in Ukraine, and very often they are lacking this type of the testing phase, when we try experimental phase, when we try to control, actually measure more robust, more rigorous way what are the real effects of intervention. Okay, so maybe I would like to ask you maybe now, if we have not much time left, but maybe you have some opinions. Was it anything what was presented interesting for you? What you think is can be somehow useful for Ukraine, or it can be somehow you can start thinking about implementing it? Not saying that we expect any declaration, but rather thinking. What do you think? What do you see it as an interesting approach? I see there are some. Oh yes, Mrs. Lomakina, please go ahead.
Ми з великою вдячністю дивилися на ваші презентації. Україна робить лише перші кроки в запровадженні дуальної освіти. Разом з пані Уляною Токарєвою ми були в знайомчій подорожі в Австрії, в Відні. Ми бачили те, як з перших кроків молодь з інвалідністю долучається зразу до роботи, і прямо під час роботи відбувається навчання. І це такі дійсно майстерні, які спочатку навчають, але все це навчання задизайновано всередині процесу роботи. І це вже їх робота, і вони вже отримують якісь певні гроші за свою роботу і так далі. І там ми бачили прямо моделі, як це можна застосовувати на практиці. І ми розуміємо, що нам треба пробувати буде такі моделі в Україні, тому давайте подумаємо разом з Міністерством молоді, з Міністерством економіки, з Міністерством освіти, звичайно, бо що ми ще побачили і зробили за цей рік за підтримки Європейського Союзу, декілька професійних закладів в Україні були модернізовані. При відвідуванні вже ми бачили, як молодь з інвалідністю змогла навчатися, бо були створені відповідні умови під час цього. І це такий певний поштовх, вже йде система професійної освіти України. Тому, ще раз, шлях важливий, він точно не один день, але дуже важливо, що в нас є докази, що це не лише наші спостереження, які ми побачили як українська делегація в Австрії, а що це у вас вже є зібрані докази, що починати треба прямо на робочому місці, досвід роботи має значення, і що підтримані робочі місця мають створюватися. В нас є прийнятий вже закон 42-19. Він був придуманий нами ще в 2020 році. У нас більше 5 років пройшло, поки ми змогли перебороти Верховну Раду, і він був прийнятий, і депутати підтримали вже його. І там є вже цей поштовх для створення підтриманих робочих місць. Але зараз крок за тим, щоб виписати правильну нормативно-правову базу, щоб урегулювати це тепер на рівні підзаконних актів. Тому, якщо можна було до когось з ваших колег звертатися за підтримкою, так для нас це також було цінним. Бо поки ми не розуміємо, що це не лише рамкове наше бажання, а як ми це зробимо, нам дійсно
that we want, we have motivation, but we still don't know how to adopt our normative acts and regulations. Thank you so much for your wonderful presentations. I took pictures of all of your slides because I had to think about the implementation, how we can use this knowledge in our practice. I do understand that I will not be able to copy everything because we have a different context, but nonetheless, we can look at successful examples and we can think which examples could be useful for Ukraine. Thank you so much. I hope that we have here the representatives from the Employment Service of Ukraine, from the Ministry of Economy of Ukraine. We are planning to cooperate a lot in the future, and I think we all have to think about this topic together. Thank you for attention.
Thank you very much. We also share with the presentation with you, and we are very happy to work with you. And if you want if you will have specific question regarding your reforms or plans that you would like to some kind of the more technical, more detailed support, also let us know. We are here to help you. ITF is for you. So absolutely, we will be very happy to cooperate and to contribute as much as possible to your reforms. Now I see Daria Andrunina want to say something. Daria?
Yes, dear colleagues, if I may, a very short intervention from my side. Daria Andrunina, State Employment Service of Ukraine. First of all, I would like to thank to ETF for your continuous support and for your valuable guidance of us in different spheres of policy design. And of course, State Employment Service has clear goals according to state employment strategy and strategy on barrier free. And I think that the main lesson today from this extremely interesting seminar is that we always talk about design of new services, but actually it's more about question how to coordinate between institutions and how to propose individual support to people. Because when we talk about people with disabilities and their employment, we understand that it's this topic is more broader than just active employment programs. And that's why thank you for your guidance, and we will be very grateful for your materials. And also, I think I'm confident that it's precisely a spirit of use guarantee, actually, how to combine all our services and how to take concrete support to concrete people in concrete time when they need it. So thank you one more time.
Muted again. Thank you very much for those kind words and appreciation. So. Okay, so I don't know whether we have now any. I don't know. Maybe Ivona would like to say something.
We have Julia with her successfully raised hand.
Sorry. Yes. Yes. Now I can see. Sorry, Julia. Yes.
Yes. I just have a kind of one more. Idea. I'm not sure if it's possible to develop a cooperation in case of that research, because I'm also a researcher and it's very close to me to build our system already data-based, and if it's possible to collaborate in that methodological case, to build from the scratch the methodology of research. I'm not sure if it's possible to talk with I don't know, Joanna or someone else from your team, because in Ukraine we have also many universities which have a good background, but I don't find it necessarily to start from beginning if it's already some investigations done. And if you have some ideas in this field, I'm also open to discuss. Thank you.
Absolutely, please contact us, and we can also invite you, Anna, if you will have time. But absolutely, we will be happy to provide you advice in terms of design, the evaluation research, specifically randomized control trials or quasi-experimental approaches are also possible. We can discuss it in more detail. Of course, every time when we have a specific intervention, we have to design specific type of research. But we are now kind of developing this type of this area of work at ETF as well. So we hosted at the one workshop we had in the last year in Cairo, and also later in September in Torino, and also Daria Andrunina was recently in Italy, in Bari, on another event we organized about this topic. So we try to touch this topic, and we are also very much in touch with Ukrainian experts from the Ukrainian Evaluation Society who are specializing in this topic. So we can also contact you with them if you. Yeah, we'll be happy. We'll be happy to support you. So please just drop me or to Ivona a quick email about and then we can meet specifically for this, and we can discuss in more details and next steps.
If I can also on this point, and I would like to thank Julia for exactly mentioning the point of evaluation, but also building the monitoring framework. We had a first discussion already last year in October that was very much linked to youth guarantee, but and then actually Piotr was with us because Piotr is our key person also for the evaluation design and for research design. So this is very close to his heart, and he is following also within ETF on disability policy and on evaluation and impact assessment. So this is a great forum to discuss potential further engagement. And we received already preliminary a request to follow up on the monitoring framework for the youth guarantee, but we could expand it, and exactly Piotr together with our other colleagues started to work also on the area of impact assessment and of integrating evaluation into policy design. So we could combine actually both potentially if there is such an interest, and even organize here. This is something that we would need to discuss if the interest is confirmed, maybe a short training seminar even in person. But for that we would need to have a number probably of preparatory meetings. That would also, as underlined by colleagues before, and Piotr mentioned it, that is worth to integrate already this monitoring and evaluation element into even piloting. That was also very much mentioned by Joanna. This is a very often forgotten element. First, we design a pilot, we are piloting and we are assessing, and then we are rethinking the intervention itself. But it's also worth to, for example, integrate already a randomized control trial to really have at least a higher certainty what can work in a certain context. So with this, definitely I would be very happy to follow up both on specific thematic focus on supporting young people with disabilities, but also adults with disabilities, but also in the broader context of policy design. We had this discussion also with State Employment Service, because they are, of course, on the front line when it comes to integration of into the labor market. So it would be good to have exactly the continuing discussion also with other ministries, so to have again, the coordination element so much underlined also by Mrs. Lomakina. So with this, I think we have a number of elements for the follow-up. So I would be happy to continue also the exchange in writing so we can design our next step work plan. So thank you very much for this.
Okay, thank you very much. I also would like to thank you very much our colleagues from Ukrainian Ministry of Sport and of Youth for Sport, especially Ms. Tokarieva, Deputy Minister, but also Ms. Tatiana Lomakina. I would like to thank you, Joanna Hoffman, for her time and presentation, and Ivona for organizing this, and our colleagues from TRI who also have organized this meeting, and interpreters. Thank you very much and have a nice afternoon, and we'll be in touch.
And many thanks to Piotr as well for running the seminar. Thank you very much, colleagues, for the continuing engagement. And we will follow up. All the best to you all.
Thank you very much.
Thank you.
you.
Have a good day.
Goodbye.